Try something with me right now. Swallow once, just once, and notice what you feel at the back of your throat, a thickness, a coating that refuses to clear no matter how many times you cough this morning. You have probably cleared your throat dozens of times today already. And if I asked you exactly when this started, you might not be able to give me a clear answer because it crept in slowly. First, just mornings, then all day. Now it is simply part of your life. You carry water everywhere. You avoid certain foods. You have tried every remedy a neighbor or relative ever suggested, and here you still are. I need you to hear this clearly. That mucus is not random. It is not simply age catching up with you. Your body does not produce symptoms arbitrarily. Every persistent symptom is communication, and the only question is whether you know how to listen. Today, I am going to teach you exactly that, because in my work in preventive health with older adults, persistent throat mucus is one of the symptoms I see most consistently misunderstood and mismanaged. People get handed lozenges. They get told to drink more water. They get dismissed, while the actual cause sitting quietly underneath never gets addressed. That changes today. I am walking you through 5 specific, research-supported causes of persistent throat mucus in adults over 55, and I am going to tell you which 2 of these are almost certainly operating together in your body right now, because they very often do, and why that combination makes everything significantly worse. My name is Dr. John. I work in preventive health and senior wellness. Before we begin, tell me in the comments whether your throat mucus is worse first thing in the morning or stays with you all day, because your answer tells me a lot about what is actually driving this. Let us start with the biology almost nobody explains, because it changes everything about how you understand this problem. Your body produces mucus continuously, and that is completely normal and healthy. Mucus protects your airways, trapping bacteria, dust, and viruses before they reach your lungs, and keeps throat tissue moist and resilient. Mucus itself is not the problem. What changes with age is what happens to it afterward. Your airways are lined with millions of microscopic hair-like structures called cilia, whose job is to sweep mucus upward and out continuously, keeping it thin and moving. In a younger adult, this clearance happens almost instantly. Research confirms that as we age, cilia slow their beating, and mucus that would have cleared in seconds at 40 can sit and pool for hours at 65 or 70. This means any factor pushing your body toward excess mucus will hit harder and last longer as you age. That is simply physiology, and understanding it is the foundation for everything else. The first cause, and the one research consistently identifies as the most frequently missed explanation, is laryngopharyngeal reflux. Most people know classic heartburn, that burning sensation after a heavy meal. But there is a quieter version with no chest burning and no obvious digestive discomfort at all, just a throat that will not settle. At the junction where your esophagus meets your stomach sits a muscular valve whose job is staying closed after eating. As we age, this valve can gradually lose tone, and when it fails to close completely, stomach acid travels upward into the throat, the voice box, and sometimes the nasal passages. Your throat tissue is not built to tolerate acid the way your esophagus is. Even a trace triggers an immediate protective response, flooding the area with thick mucus to shield it. When this happens night after night while you sleep, you wake every morning to that familiar heaviness with no apparent explanation, since there is no heartburn pointing toward your stomach. Research published in clinical ENT literature shows that up to half of people with this condition report no heartburn at all, just chronic throat clearing and a morning voice that sounds rough. Ask yourself honestly, is your throat worse in the morning? Does it worsen bending forward? Has your voice sounded different upon waking? These are the fingerprints of silent reflux. One additional note. If you regularly take anti-inflammatory medications like ibuprofen or naproxen for joint pain, research has established that this class reduces the stomach's natural protective lining, making acid reflux, including the silent variety, considerably more likely. Raise that connection with your doctor if your throat has been persistently bothering you. The second cause arrives quietly and goes unnoticed for exactly that reason. When people imagine sinus problems, they picture intense facial pressure and a completely blocked nose. But in many adults over 55, chronic sinus inflammation presents almost invisibly. Breathing feels fine. There is no significant headache, yet the sinuses, mildly swollen, are draining steadily down the back of the throat all day. This is post-nasal drip, and a 2024 study found the average age of presentation is exactly 55. Many people dealing with this take antihistamines for months, assuming seasonal allergies. That strategy disappoints because antihistamines dry mucus temporarily, but do nothing for the underlying sinus inflammation, and dried, thickened mucus is often more uncomfortable than the original problem. The approach with the most consistent support is regular nasal rinsing with warm saline. A 2025 clinical review in the journal Medicina concluded that nasal irrigation is effective, safe, and low cost for treating and preventing upper respiratory conditions, and is widely endorsed by ENT specialists internationally. High-volume saline rinses physically clear inflammatory mucus, reduce mucosal swelling, and improve the same ciliary clearance function that declines with age. The key word is consistency. Daily practice produces cumulative improvement. The third cause is the one that produces the most genuine surprise, because the medication responsible is usually one taken faithfully for months or years without ever being questioned. ACE inhibitors, a class of blood pressure medication prescribed millions of times annually, carry a documented class-wide side effect. They allow a substance called bradykinin to accumulate, and in 5 to 20% of users, that accumulation triggers persistent throat irritation. This is not an allergy. It is simply how the drug works. The side effect can take weeks or months to appear, so if you started a blood pressure prescription 8 months ago and your throat began bothering you 6 months ago, you may never have connected the two. A study of more than 27,000 patients found adults over 65 had 53% higher odds of this side effect than younger users. If you take a blood pressure medication, your pharmacist can confirm whether it belongs to this class in under a minute. If so, ARBs, angiotensin receptor blockers, control blood pressure equally well without this side effect, and that conversation with your doctor is worth having. The fourth cause surprises people not because it is complicated, but because it seemed too obvious to matter. Hydration. The physiology here is more specific than most people assume. Your mucus is mostly water, and its consistency depends directly on how hydrated the surrounding tissue is. Picture maple syrup fresh from the bottle versus syrup left open overnight. Same substance, different behavior. Your mucus works the same way. Research has established that the thirst mechanism becomes significantly less reliable with age. You can be dehydrated enough to noticeably affect mucus consistency without feeling thirsty at all. Waiting for thirst means you are consistently behind, and chronic mild dehydration keeps mucus persistently thick, amplifying everything else discussed today. A practical target is roughly 30 milliliters per kilogram of body weight daily from all sources: water, teas, soups, and water-rich foods, with deliberate, consistent intake throughout the day rather than catching up when thirsty. The fifth cause rarely gets discussed, and for a meaningful number of older adults, the actual root is not in the throat, sinuses, or stomach. It is in the gut. Your digestive tract and respiratory system share regulatory pathways through the immune and nervous systems. Gut microbiome health directly influences how reactive and inflamed your upper airways become. When that balance is disrupted, a state called dysbiosis, it can activate immune responses that promote excess airway mucus, not because anything is wrong with your throat, but because the gut is sending inflammatory signals the airways respond to. This gut-lung axis is an active area of research, with studies in the American Journal of Respiratory and Critical Care Medicine and the Journal of Allergy and Clinical Immunology confirming that gut disruption triggers airway inflammation. Animal studies found that mice receiving gut microbiome transplants from patients with chronic lung disease showed measurably increased airway mucus production, demonstrating a direct causal link. What disrupts the gut microbiome in older adults? Low fiber and fermented food intake, repeated antibiotic courses, high sugar, chronic stress. These describe the daily reality of a very large proportion of older adults. A lozenge will not fix a gut airway problem, but consistent daily choices can support it. Before the action plan, one genuinely important note. Most persistent throat mucus in older adults is benign, manageable, and not dangerous. But see your doctor promptly if you notice mucus tinged with blood, difficulty swallowing that is worsening, unexplained weight loss alongside throat symptoms, a lump or persistent neck swelling, or a significant voice change, not improving over time. Bring these directly to your physician. Now the action plan. Stop eating at least 3 hours before lying down. When you eat and recline immediately, your stomach is still processing and the valve has its hardest time staying closed. 3 hours upright is one of the most evidence-supported steps for reducing nighttime silent reflux. Elevate the head of your bed slightly, using a wedge under the headboard or mattress rather than extra pillows, which just bends your neck. Even a few centimeters of incline uses gravity to reduce acid travel while you sleep. Before bed tonight, drink a full glass of warm water to support overnight hydration. Tomorrow morning, before coffee, drink 1 to 2 glasses of plain warm water, rehydrating your body and loosening overnight mucus before it shapes your whole morning. This costs nothing and is one of the most consistently reported impactful changes people make. Get a nasal rinsing device, a neti pot or squeeze bottle, from your pharmacy. Use boiled, cooled water, never straight tap water, with a small pinch of plain salt and optionally a tiny pinch of baking soda. Use it once daily, preferably mornings, and give it 2 full weeks of consistent use before judging its effect. Schedule an appointment to review your medication list against your throat symptoms, bringing a written timeline of when symptoms started and when medications changed. If you take a blood pressure medication, ask directly whether it is an ACE inhibitor and whether an ARB might be appropriate. To support the gut-airway connection, add 1 small daily serving of fermented food, plain yogurt with live cultures, kefir, kimchi, or sauerkraut. This is a long-term strategy that genuinely shifts your baseline over time. Set hydration reminders, keep water accessible throughout your home, and add water-rich whole foods like cucumbers, watermelon, soups, and herbal teas. A quick word on common remedies. Honey genuinely soothes irritated throat tissue and is not harmful, but does not address any of today's 5 causes. Dairy does not create mucus from nothing, though some people notice it thickens existing mucus, and a 2 to 3 week elimination trial is worthwhile if you notice a pattern. Apple cider vinegar is popular online, but for anyone with silent reflux, additional acid can actually worsen the problem, so approach it cautiously. Here is what I want you to walk away with today. That persistent coating at the back of your throat has a reason. 5 possible reasons, in fact, and most people have never had even one properly explained to them. Silent reflux happening while you sleep with no heartburn warning you. Post-nasal drip from chronic sinus inflammation that never announces itself dramatically. Medication-related irritation from ACE inhibitors, developing months after starting and rarely connected. Chronic mild dehydration running below the threshold of obvious thirst, and gut microbiome disruption sending inflammatory signals your airways respond to. None of these require accepting a life of constant throat clearing. Each has a practical, evidence-grounded response, and none require a prescription to begin addressing. If anyone has told you this is just getting older, I hope today gave you a different lens, because you are dealing with specific, identifiable, addressable physiology, and you deserve to know that. If this gave you something useful, share it with someone quietly dealing with the same thing. And tell me in the comments which of these 5 causes surprised you most. This is Dr. John. I will see you in the next one.